Bangladesh, India and Pakistan have all ratified international and regional human rights treaties recognising the right to health, including the International Covenant on Economic, Social and Cultural Rights and the Convention on the Elimination of All Forms of Violence Against Women. These UN conventions regard gender equity and the right to health as a human right. However, women and girls in these countries continue to suffer gender-based inequality and disadvantage, which often has dire consequences for health. Women and girls in these countries experience high rates of domestic and sexual violence and abuse, causing mental stress, physical suffering and death, subjected to dowry deaths, honour killings, female infanticide and feticide, forced into commercial sex work and or subjected to human trafficking, involved in child marriages and experience high rates of malnutrition. There are very high rates of maternal mortality, low rates of antenatal care and attendance at birth by skilled health professionals. There are significant sexual and reproductive health problems for women, including female genital cutting, sexually transmitted illnesses including HIV and AIDS, and pregnancy complications leading to chronic morbidity. Gender inequality is pervasive and women and girls face discrimination at every stage of their life. The Gender Inequality Index, the GII, measures women's disadvantage across three dimensions: health, the labour market and empowerment. Values are measured across a continuum where 0 equals perfect equity and 1 is total inequity. The 2013 United Nations Development Programme report gives Bangladesh a GII of 0.518, ranking 111 out of 186 countries, Pakistan 0.567, ranking 123, and India 0.610, ranking 132 out of 186. India, Pakistan and Bangladesh are all patriarchal societies. Patriarchal values are entrenched in social life and reflected in institutions, including the family, where the notion of family honour controls and restricts women's life choices, status, employment and voice in both the public and private sphere. This context poses serious challenges for the empowerment of women and access to health information, resources and services. Governments in all three countries have been working to address gender inequalities through legislation and policies. However, there are significant implementation issues, and addressing the underlying socio-cultural factors related to a male-dominated and patriarchal society is a major challenge. Attaining equality and empowerment of women will require effective implementation of laws, legislation and policy, and the continued advocacy for women's rights and capacity strengthening. It will require significant improvements in investment in access to and utilisation of healthcare and scaling up of reproductive and maternal health services. This will require fundamental social transformation, including major changes in norms and perceptions, the redistribution of power and increased economic opportunities for women. The improvement of the status of women is not only essential for health, equity and human rights, but also for economic growth, poverty alleviation and human resource development in these countries.